Hi, my name is Ashley Bond, and this is my presentation for Found Concepts and Application. The essential that I have chosen is person-centered care. Person-centered care is going to be developing a relationship with the patient that allows the provider to treat holistically. As a provider, this means that we're going to respect diversity. We're going to utilize specific patient knowledge to make the most appropriate decision for each particular patient in every case. This means respecting the patient's history, their circumstances, any viewpoints they may have, opinions on healthcare, opinions on treatment, opinions on their illness, whatever that may be, but respecting and understanding them for who they are and taking that into account. Some central themes of person-centered care are going to be empathy, putting yourself in their place, engagement, making sure that they are an active part, the relationship, keeping those open lines of communication there. Communication, of course, how you keep those open lines of communication or how you keep that relationship going with the patient. Shared decision making, where you are both partaking in whatever the treatment may be. And then a holistic focus, incorporating all parts of the patient as well as coordinating care, making sure that every aspect of their care from start to finish is smooth for the patient. The holistic approach. Who are we going to use this on? We are going to use it on everybody, this person-centered care. It is for every patient, every provider, every specialty. So this is going to be young, old, different ethnicities, different patient populations, wealthy, poor, every patient, every provider, whether you are a specialty provider, an APRN, in an urgent care, in a hospital, you're going to be able to utilize this as well as every specialty. So ENT, OBGYN, pediatrics, it is relevant in every situation. Again, when every patient, every interaction, always incorporating them first and foremost, or the patient first and foremost in the interaction. How are we going to utilize it? We will utilize that specific patient knowledge as well as care and communication to form the best treatment and plan of action for the patient, incorporating their input as well. Why do we do this? Incorporating the patient into the wellness team does enhance both the patient experience, it humanizes our patient, and creates the best holistic treatment for the patient to ensure the most important or best outcome for the patient. Changing the narrative. So back in the day, healthcare tended to have more of a disease-centered care approach. I found a really neat graphic at the below disease-centered for care. I kind of redid it myself to, bring it into our easier picture to see. But it kind of shows the difference between patient-centered care and disease-centered care. So changing the narrative, we are providers, but we are not the only care team member. So that was kind of in the past. The patient was the disease. They were not a part of it. Now the patient is an individual. Nowadays, the patient is going to play an active role. That means that we are ensuring that they have a say in what they do, as well as we're going to have some more informed patient populations. Nowadays, patients do have phones at their fingertips, so that does make a big difference in their ability to be a part of the care team. They can look up different things about their care. They can look up different things about their treatment. So we want to make sure when we're doing this patient-centered care, going back to that graphic, that we are treating based on communication and trust, and we are collaborating patient and provider. Where back in the day with this disease-centered care, we were looking at strict treatment pathways. Patients didn't really have a say. It just kind of was based on the disease. And then the generic cost-based treatment. So whatever was the most profitable or the most cost-effective for the healthcare system or healthcare professionals. Now we are going to go back to the essentials, as this is an essential. Kind of the best way I felt to teach this was to go based off of the competencies and sub-competencies. So we're going to kind of review them, but more in the sense of what's actually happened and not just what they are in the essentials booklet. So the first one is going to be engaging with the patient to establish caring relationships. The way that we are going to do this is we are building trust with our patients. We are overcoming biases. We are learning individuals for who they are, what they can give, to you as far as their experiences, what they want. Ways we're going to do this: fostering caring relationships, open and honest communication. That is going to be built through repeated encounters. Ways that we can do that, of course, is going to be with our second competency, communicating effectively with patients. We're going to communicate with them. We are demonstrating advanced communication skills. So we are utilizing open body language, both verbal and nonverbal, to promote openness. We are going to design evidence-based material for the patient, whether that patient seems to do better with something that might be an application if they're a younger generation, or a pamphlet if it's an older generation. We're going to provide something that directly relates to them and is logical to that particular audience. We're applying individual information and delivery of personalized care. So we are incorporating genetic information, pharmacogenetic information, environmental information, but really incorporating very personalized care in communicating with those patients. And then we're also facilitating some difficult conversations, or facilitating sensitive information. So we're going to use just kind of practical life knowledge to gently discuss these things. Everybody's had to have a difficult conversation at some point. And we really want to use those empathetic, sympathetic phrasing. We want to use that open body language so that those difficult conversations are easier. That helps to go back and, like I said, establish caring relationships through that open communication and communicating effectively. Next, we are going to integrate assessment skills into practice, demonstrating informed practice through comprehensive assessment, appropriate to whatever area it is you're doing. We're going to fully assess the patient, whether you are doing a head-to-toe or a specific assessment. You want to make sure that you include everything about them: the mental, the physical, the spiritual problems, whatever they have going on, because you are going to need that to then diagnose potential and current problems. Those are going to be diagnosed through not only what you assessed, but then also context and reasoning in your diagnosing and decision making. So when we diagnose, we want to utilize the full extent of our nursing knowledge, patient history, and evidence-based practice to make the most correct and holistic diagnosis. We want to incorporate scientific knowledge, past experiences, as well as the patient's past experiences. Nobody knows your body like you know your body, so it is very important to incorporate patient past experience in that as well. Developing the plan of care. When planning to treat a patient, we want to be the leaders in collaborating with other specialties when necessary. This is the best thing for the care. We want to lead the team, always mitigating risks as best you can, preventing adverse outcomes, using knowledge and evidence-based practice to prevent whatever risk can be avoided. When evidence-based practice does not exist, however, it is important to be creative and to incorporate logical interventions into practice. There will not be a blueprint for everything, but using creativity and innovation to best make interventions that would help the patient, which the patient may be able to give input for. Demonstrating accountability for care delivery. We want to make sure that we are taking charge in modeling the best practice, applying research to care delivery, utilizing past interactions with knowledge and evidence-based practice to provide the best care plans, and then also applying current and growing evidence in the care guidelines. That's constantly changing, constantly getting better, and you want to be sure that you are growing with the evidence to provide that best care delivery. Evaluating outcomes. As future advanced practice nurses, it is our responsibility not only to create the plan, but to also follow through and ensure effectiveness in the treatment with the patients. We are no longer just nurses who are applying whatever treatment it is that the provider has given us. We are going to be the providers ourselves. So very important to evaluate these outcomes of care. We want to go back and be able to review data To identify gaps in care, we also want to make sure in doing this that we are treating populations, different patient populations, fairly, that we are making sure that there is not care gaps between, different care populations. This is a very common thing in my area. In lower income patient populations, they do tend to receive lesser care. So as advanced practice nurses, we want to make sure that whether the patient has extreme financial means, lesser financial means, is English speaking, is non-English speaking, that they are receiving the same care and the best care possible. We also want to be able to compile this data for future evidence-based practice. We are the future providers, so we want to be building upon these evidence-based practices, as well as influencing the practice guidelines. That's going to be key for us. Promoting self-care management. For this self-care management, as the patient is a major team player, is going to be starting by developing strategies with current emerging technology to support self-care management. When we are developing these strategies, we want to make sure to take into account things such as patient resources. Not every patient will have access to something that another patient may have. In doing this, we are going to make sure that the patient has the most realistic discharge plan to continue to take care of themselves. We want to utilize every tool at our fingertips. These tools may be tools that are public tools. These tools may be tools that are in the community. Part of doing this is going to be fostering community partnerships. A couple ways that, we can do that is going to be to have discussions about future healthcare, evaluate how that patient will be able to support their own health journey when leaving a healthcare facility or provider. If the resources are deemed lacking, such as if a patient needed a blood pressure cuff or needed to have consistent blood pressure checks or blood sugar checks, but didn't have the means, being able to set up a partnership, if they have a local Walgreens or a Walmart and a Sam's Club, somewhere that's got a local blood pressure cuff, that may be a good option for them to check their blood pressure. Also, if a patient had future appointments coming up, but they didn't have a car, as the provider, it's our goal to set up maybe a carpool or a car share, ride share, different car services. In Knoxville, we have a CAT bus where patients that cannot drive or are disabled can get driven to doctor's appointments, assisting in setting that up and ensuring a full connection from start to finish in this healthcare journey. Very important for our patients. Promoting care coordination. Healthcare for patients and for us sometimes can be very confusing. It can be like a maze. Patients are lost. I notice a lot of the times with my veteran patients, especially, they are sent to us with not a clue why they're there, how they got there, what we are meant to be treating for them. So I think as advanced practice nurses or future advanced practice nurses coming from that nursing care, being that kind of leader or handholder through this, it's very important that we help guide them through this care coordination process, that we help guide them through the system, that we communicate with them why they're going, where they're going, help optimize those care transitions, make it clear the reasons that they are going to a particular provider, have clear, open communication between providers. We also want to make sure that in the future, that maybe even we change policies that will create more fluidity between care coordination. I think there's a big gap between providers nowadays. They think that something's not their problem, but the provider I work for, he's kind of always talked about, even though he's an ENT, he is a primary first. Patients are fluid, their bodies are fluid, their health problems are fluid, person-centered care is fluid. And so in saying that, it's very important to ensure that we are treating the patient as a fluid, active being, and that we are connecting their care in that same exact way, that we are ensuring fluidity. The benefits of person-centered care. Why are we doing this? The benefits of person-centered care are very vast and very important to the patient. First, better health and well-being. The goal in nursing, the goal in advanced nursing is for the patients to have the best life. Better health and well-being, it promotes freedom of choice, patients having a say in their healthcare. It helps them advocate for themselves. That's incredibly important, as if they can advocate for themselves, they are part of the care team. They are improving their quality of life. They're reducing their anxiety. They are being a part of their health, and in that they can have better outcomes, have better health, have more control in what they do. It promotes positive mutual interactions for the healthcare provider and their patient. There's better teamwork between providers and the patient. The patient is part of the care team. The patient has a say. It helps them feel like they are actually doing something in their health. And that's something that is so important to patient outcomes, that they can be a part of their health and they have a say and they are in control somewhat, because when you're sick, you do feel so out of control. There is it is a more cost effective way of care. Generally can shorten hospital stays, which reduces patient costs overall. And then they also can have a say in what types of medicines or what kind of treatment they want. If they opt out of a treatment for cost reasons, they may be more inclined to do other home treatments or things like that that may be more cost effective to them. And finally, it also has a positive work environment. It reduces stress among staffs that participate. And then it also helps meet the needs of individuals more effectively. Therefore, the patients get better care because they are participating in their own. The staff feel less stressed, and then they can go along to share that less stress to patients as better caring members. So just an overall win-win for everybody involved in patient or person-centered care. Very important to utilize for your future as an advanced practice nurse. Finally, these are all the references for my PowerPoint. I have tried to put the reference themselves on each PowerPoint slide if you want to go back and refer them any further. Thank you very much.